Another disease. I hope so you're okay with
Yes.
it. The other disease that we are going to really tackle is one, and that is Ebola. You telling the people that IPC shouldn't only end on mpox, however, it should also go to other diseases. It is so effective and it is so good to advise health workers. You know, the way Ebola spreads, or the way most of the virus spread, almost it is the same way. And well, it is so awkward that sometimes it gets also health workers. Yeah. Now, moving to Ebola, the lay person, the person in the facility, they are those ones that have just gotten out of school, nurses and midwives. How would they understand that this is Ebola? How can someone know what could be the overview? What could be, okay, what could Ebola be?
First of all, as a disease, it's a viral, we call it a viral disease, but it's also called, I'm trying to find the right words. Okay, it is a viral disease, but it's a hemorrhagic one.
Okay.
A hemorrhagic fever is the kind that one of the symptoms is unexplained bleeding. But usually by the time we get to the bleeding, it's too late.
Okay.
So Ebola is a very dangerous disease that usually when it comes into a community, at least half of the people who get it die.
Okay.
Okay? Why do they die? It is a virus. By the way, viral diseases don't have treatment. Okay? We manage symptoms. There's headache, we manage the headache. There's the area, we manage, we replace fluids. Your body fights. That's why people with low immunity are usually more affected, because their body already was low or had a weak immunity. Now, Ebola being very virulent and very stubborn, it does not have specific symptoms. You get a fever, you get a headache, you get body weakness, you may get some flu, all those ones. Haven't you ever heard of them on another disease?
Yeah, probably.
It's like you might vomit.
Will even say, I think I have malaria.
You might vomit.
Yeah.
All those are pointing to malaria. Because malaria is more common in our country, you may think it's malaria. But while you are not treating the disease, the person is progressing. By the time someone bleeds, it's too late. By the time you start seeing blood coming out of their ears, their mouth, their nose, it is too late. So that is why it is important to prevent than to treat. Okay, so, but when it comes to the health workers, those ones I'm not worried. They are well trained to handle all diseases, because we know when you're talking about infection control and prevention, we know infections can move from one person to another.
Yes.
So they are trained. The most important thing is keep what you are taught. Keep doing what you are taught. The day you relax, don't put on gloves when you're supposed to. Is the day you made contract. You just don't know. The other thing I didn't talk about is what is most important is awareness. Let the communities know. Let people know. You know, I may tell you to wash your hands, but you know why you will not wash them after some time? Because I was done telling you and I've gone away. But if I explain to you why you should wash your hands, you say, sawa avuddewo naye ntegedde lwaki akola ki ninakoza engalo. Yeah, I've known why I have to wash my hands. Even if it is children understand. Even a nursery school child, they know that after the toilet they what?
I wash my hands.
So if a child of 3, because usually they start school at 3-4, if they know that I'm supposed to wash my hands after the toilet, then why don't they wash their hands every time if you were to teach them? So some of these practices are not cheap, affordable, because I'm not going to go and buy this. No, the things at home, at school, but let them wash their hands. Let them know, if I don't wash my hands, I'll get diseases. Not only for Ebola, but for all infections. Okay, so for us to avoid Ebola, again, Ebola is moved through contact. the same way.
The same way. The same way most of the infections do.
Some of the ways to cut off contact, if I have touched unknowingly, if I wash my hands, I have reduced the chances of getting the what? The disease. It could be reduction to 0 or reduction to 5%, I don't know, but you may have reduced a lot. Especially with soap. You probably have also protected yourself well. Yes.
So where there is Ebola, and you talk about, you know, the others that like soccer, the others ones that like many games that can cause them sweating. And probably, you know, in soccer they might
hug
yes, the word.
when there's excitement.
Yeah. So the advice she's giving, these diseases can be avoidable.
Very
All of them,
avoidable.
yes, they can be avoidable. But when you relax in the things of IPC, we say IPC meaning infection prevention and control. When you relax and washing your hands, when you relax knowing that, you know what, if at all there is a risk of me contracting some, okay, let me say flu, let me cover my mouth and the nostrils where I can get contracting the, okay, inhale the virus or what. So let's not relax as health workers. And to those that have just gotten out, these diseases are real.
They are real.
And we are going to treat a lot of diseases that are similar to this. So if at all you're taught about IPC, touching a patient, where you've been in schools sometimes touching dolls, it has not been applied that you have to put on a glove. Every patient that you touch on, please, the glove should be on. And
Protect
another
yourself.
glove per person, because you might touch this one who has Ebola and then it
Carry
goes,
the infection too.
to another person. The signs and symptoms, you've hinted on them, and probably I just want the predisposing factors, how it is spread, yes, you've hinted on it, and the causes are probably in the overview. However, there's one thing, or two things. I just wanted you to hint on the overview of Ebola. That is the Ebola. I hear Ebola Sudan, Ebola Congo. I hear that. So I just want I just want you to hint about that, and then the way we can avoid it. We go preview to the treatment. If at all there is treatment, then we can see if at all there is no treatment, what can we do?
Okay, so we talked about the Ebola, Sudan Ebola. So those are strains. We call them strains. We test in the laboratory because you hear that we are having Ebola Sudan, Ebola Zaire. So when we get a sample, an Ebola sample, a blood sample, we test there is Ebola virus. Then we test what type of virus is there or what type of strain.
Is it?
So these strains have been named depending on where they started from. Like from the time that when that strain came in, it was discovered it was different from other strains and it started from that country. That's why they're named like that.
Okay.
So that's when you hear those names. It is just basically done in the lab, and it helps to name them because they are different, and so even their course of management is also different.
Yes.
But like I told you, Ebola is a viral disease. Viral diseases do not have specific treatment. We give supportive treatment. So if you have diarrhea, you'll probably be given fluids to replace as your body is fighting.
Yes.
You
So
have
it is the
headache?
immunity that fights.
Yes.
Okay.
If you have headache, you'll be given some painkillers. If you have a fever, you'll be given something to calm down the fever as your body is. When the body loses the battle to the disease,
then you're gone.
yes.
Meaning boosting the immunity can also be thought of.
Yes.
Probably eating well.
Eating well, fruits.
And probably people think eating well is another thing of eating chicken, what. But probably eating well means a variety of a balanced diet.
A balanced diet, basically.
Probably fruits, proteins, carbohydrates, but more so fruits. Most of the fruits I hear, grapes, I hear
all types. Yeah. Most people say I cannot access this. Just eat the fruits in that season.
Yes.
There are seasons when pineapples are very cheap. Eat them. There are seasons when watermelon is cheap. Eat it. But we are lucky as Uganda. We have a lot of fruits. Just eat a variety of them.
Okay.
Yes.
So that is one way we. So how can we avoid this?
Again,
the same way.
Avoid contact.
Yeah.
Yes.
Let's avoid
Wash
contact.
Your hands.
Yes.
Crowded places, especially now when there's an Ebola outbreak. Crowded places, stay away from them. You talked about footballers. You notice that when we had COVID-19 and there was so much unknown, the world was put to a standstill because they were trying to avoid. They were like, let's first stop.
The spread was cut off. Yeah,
so now we know Ebola is spread the same way. You don't need a lockdown. Just stop. Okay? You're going to go to work, be careful. You're going to move here to there. If you have to move carefully. Don't go to crowded places where there's sweating, gym, what. You may want to stay away from them, at least for the season when the outbreak is on. Maybe later you may. But basically, like I told you, as a country, we are predisposed to most of these diseases. By the way, what we didn't talk about is where does Ebola come from? Ebola's reservoir are monkeys and bats.
Still.
Where are they found? Haven't you seen them in your country?
Yeah.
Or around your home?
Yeah, probably.
So chances are high that you could get predisposed to this and get that disease. Okay? So which means we are already in a region where these diseases, that's why they keep coming back. So as they keep coming back over and over again, we have to get into a culture of always protecting ourselves all the time. Now someone may say, are we going to be like on tension all the time? No. When you get used to doing something, it's no longer tensions. It is now a routine. Washing hands, we've always known from when we were young. Wash your hands even before you eat food. Wash your hands, they are dirty. Wash your hands, you get. So just practice. Keep doing what you are taught to do. Even by our grandparents. Hey, these are things they would tell us. They were asking us to eat food so that we don't get probably diarrhea. But in that way, you're also avoiding getting other diseases altogether. So close contact, keep away. In case someone is sick, and for example, they go to hospital, they check for malaria, it's not there. They give malaria treatment, it's not working. They do this. Please report immediately. So the person, you may fear, but the problem is you may not save your friend's life or your relative's life, but also yourself, you might be at risk.
Danger.
Because remember, when an Ebola patient is discovered by the system, by the Ministry of Health, they will get the patient and take them away for treatment. But they will keep monitoring the contacts to ensure that you don't get
the disease.
And if you do, you're picked up quicker. When I start saying, I have headache, I have fever, for you, we can pick you quick and begin to manage you, rather than the other person who came in late. So your chances of survival are higher than person who came in late. Just like any other disease. If you go to hospital late, when the disease has already gone some days, you may find already in severe stages, chances are high you may not survive. Yet someone who goes early and is checked, they find the disease is there, but it has just started. They will just be treated and say, but I also had the same disease, I survived. No, the other person went late.
And this one went
And remember the diseases we are talking about. We are looking at it as headache, but when all these symptoms are in, there are other things they do to the body. They can affect your kidneys. They can shatter your liver. They can affect your lungs. Okay, so at the end of the day, by the time you come in, you're saying, I have heaviness of breathing. When the lungs are already
dead, they're down already.
Yes. You're already down. You have difficulty in breathing. For you, are feeling difficulty, but probably 90% of your lungs are already gone.
Yeah.
You see, but if you had come earlier, probably would have saved, maybe 10% would have been gone, so we save. You understand? So it's very important. If anyone is not well, nearest health facility.
Go for assessment.
Yes.
The disease affects me, I affect you, and you affect another person. So it is important for us to be conscious of even our neighbor, even our relative. It is important to spread the information to the last person. It is important for you to know, even a health worker, to know that the people that you're working on or at, someone can come in with malaria and goes with Ebola. So someone can come in with another disease, contract another one from the hospital, goes back, they have treated, they rolled out malaria. Yes, they tested, everything was positive, and they were like, it's okay. Now the Msau who has touched the patient has gotten the other infection from the other person who was sick of that infection, because in your explanation, I've seen that most of the signs and symptoms are onto Ebola, minus the last one. All are in other diseases. So, yes, we might have not seen the blood, the real blood that someone is
bleeding.
bleeding, and someone has the virus. So it's better go to the hospital, get assessed, tested, and if at all there is, they are telling you there is nothing, and for you you're feeling there is something, please let you as a health worker contact the Ministry of Health for them to take action. Thank you, Brenda.
Thank you.
Thank you so much.
You're welcome.
For the time, maybe you'll get us another time, come and explain us about another infection. We shall maybe link up and we'll talk about another infection
Okay.
when time allows.
Thank you too.